and what sort of treatment the person requires. And not saying much and just putting an arm around your student is like writing a book. And what is so important is inclusiveness. We'll wait for you. We are missing you. Come back to a college as and when you are fit. Talk to the parents and let them not bury the psychological interventions, because very many parents are very happy when the child survives the attempt, but they do not take any psychological intervention, insist on psychological intervention. And the college has the right to ask who's the doctor, who's the psychologist, so that they can keep in touch with them for future planning and action. Now you'll say, psychologists or the psychiatrists may say confidentiality. Well, in self-harm, there is something known as shared confidentiality with those who are part of their lives. School or college is part of their life. It's not only the family. So what should a teacher ask from the psychologist or the psychiatrist? 5 things. Number 1, is he fit to come back to college? Number 2, as a teacher, what can I do for him or her? Number 3, his exams, his assignments can be deferred. Number 4, keep in touch with the mental professionals so that you know the progress. Number 5, learn all about relapse, increase in symptoms, so that you are attentive and you can refer the person back to for an emergency consultation between. You have a right to ask the mental professional these questions, and it should not be a blind 5-line certificate that is fit to come back to college. Now, if I ask you a question, my dear friends, I'll make a statement and you have to answer. Barking dogs do not bite. Those who talk about self-harm will not actually do it. Is this true or false? Barking dogs.
False.
Okay. So people who talk about self-harm are more prone or more probable to attempt self-harm than those who don't. And that is very important. The second question is, if you have attempted once, what is the probability of attempting again? Anybody can answer.
Sir, very high.
Very high. Who is this, Soini?
No, sir. Shama from Mumbai.
Shama, you are from which college?
SIS, Science.
Okay. So very high, which is absolutely true. Once was attempted self-harm is more prone to attempt others. So you need to be careful for a long time. And people who talk about self-harm, you have to take it very, very seriously. Don't get anxious. Seek help immediately and seek screening immediately. Now, my dear friends, everybody has an opinion on mental health, cricket, and politics. So if somebody is on treatment, a close member of the family will say, no, forget it, yeah, don't take any medicines. The medicines are very bad. Stop all this counseling. Don't be dependent on counseling. Talk to God. Do yoga only, and yoga will help you to change your mind. 99% of the opinions you get from the lay people are false. Because India has an opinion on politics, cricket, and mental health. Nobody will touch a prescription of a cardiologist. They will quietly take medicine, which is very important to understand. This is something which we answered. My dear friends, some preventive tips for you to prevent self-harm in your college. Number 1, remember, if a child is doing badly, if a student is doing badly, it is not because he or she is lazy. No, it's because of DIE, D-I-E. There's only 3 acronyms. My dear friends, mental health is not as vague as or as descriptive and qualitative as philosophy. Mental health is science. It's not quantum science, quantum physics, but it's science. All of us can understand some part of it. So if you have fever, you go and do a test. If you fail, if somebody is doing consistently badly, look at DIE. D is disability. A lot of learning disability is missed in schools. Epilepsy is also a disability. Look for disability. Poor attention span also causes low grades. D is disability. I is interest. Losing interest because of poverty, bad family state, difficult teacher, physical illness. DIE is emotional states, stress, distress, or depression. So we need to find out why, and we need to address that question so that we prevent students from harming themselves. And that is so important. My dear friends, this is also very important. You must have seen the National Family Health Survey, the latest. Large number of women believe that hitting them is okay, it's normal. My dear friends, hitting is cheaper, talking goes deeper. You know, my dear friends, CEOs are not born in MBA schools, they're born in families and colleges and schools where there's enough scope for discussion, enough scope for charcha, enough scope for samvad, enough scope for debate. So, as a mother, as a father, if your child is not doing well, don't hit him. Sit down and find out what is happening, and that will always help you. Scare and inspire, or share and inspire. We have been born in a state wherein we threaten children. Padega nahi to fail hoega. Aage kya tum karenge, etc., etc. No, scare and inspire, share and inspire. Which would mean I'm very upset that you have failed. I would want you to sit down and really work hard, and I can help you if you want to. Remember, you can share, you can have three types of communication in your families. One is you can have feeling chats, which means I'm upset that you really come up 2 hours after playing and tomorrow is your exam. I'm very happy that you helped me when I was sick. I'm very, very touched when you helped me when I was having COVID. I'm very angry at you in spite of teaching you so much. You went and just screwed up in the classroom. So sharing feelings is a way of really building resilience, is a methodology of building hope and future. But what is very important is if you use adjectives, negative adjectives, you kill the self-esteem of the child. You're useless, you're hopeless, you'll never do anything in life. And that really destroys the self-confidence of child. Even in your class, if you say, I'm really angry that you've been absent from my class and I know that you have not finished my assignment, I do not know what to do with you. You'll have to follow the rules of the college, my dear friends. I understand that you have administrative responsibilities, but you have also responsibilities of touching the hearts of the children by using feeling statements and not adjectives or sarcasm. तेरा बाप का कॉलेज है, आजा कभी जब दिल है तब आजा. You know, my dear friends, students might face difficult years in their life, might face very difficult years in their life, which means they may do badly for 1 or 2 years, but they get awakened after some time. For that awakening, the teacher is the architect, which means never believing that the student is bad. Maintaining hope. Aaj ne to kal badlega. And if this hope is maintained and you believe in the child, what is very important to believe, someday they would get awakened, they would remember all the sentences that are important. Well, this is something which you all know. Sometimes children learn this entire habit. मैं अकेले बैठकर अपने रूम में रहूंगा. नहीं यार, solitude is a good place to visit, but a bad place to stay. So in the colleges, you spend lakhs of rupees for the Founders Day, lakhs of rupees probably during the annual day, maybe not all schools and colleges. Appoint at least one mental health professional, if you can, so that in a hospital, if a heart patient is not seen and has no facility for emergencies, that is psychological negligence. And what is important is you need psychological vigilance inside the college by training your teachers to become mental soldiers, to be alert. If you can afford and if you have availability in your remote areas, by having one mental professional as a part of your team in your college. These are the motivations for ending your life. Now I'll ask you a question. If a student says, मुझे फोन नहीं दिया तो मैं जान ले लूंगा, and the father says, मुझे मालूम है इसमें हिम्मत नहीं है, मैं कहता हूँ, as a father would say, जा तेरी हिम्मत है तो जाके कर. What do you think about this sentence of the father? Anybody can answer.
It's a mistake. Shohini speaking.
What
It's a mistake
what
to
should he
say
say?
that.
What should he
He
say?
said he should say, let's talk about it, Let's talk about it. What is it that's wanting you to take, thinking about it like this? What is it that you need? Can we talk about it?
Absolutely right. So never challenge somebody who's impulsive and who wants to end his life. And what these people do is, I still remember some fathers who have gone up to the terrace. Chal, kood ke bata. Jump and show me. Jump and show me. And people have jumped just to spite the father without knowing the consequences. And they die. Anybody else would want to say anything about this? I challenge my child to harm themselves because I believe he will never do it.
A lot
What
depends
is?
on the temperament of the
Yes,
child.
ma'am.
A lot depends on the temperament of the child. If you know your child is impulsive, then maybe talking would help the child. But if you know that the child is just saying it for the sake of saying it, then probably you would adopt a different strategy in dealing with the child.
Okay, I would say this as a blanket sentence: never challenge a child when he threatens suicide. What is very important is you do not understand what is happening, let somebody else find out what is happening. Just like when you have fever, you don't know whether it's COVID or not, you do an RT-PCR test. Similarly, what is very important is let somebody else check what exactly is happening, and that is so important. So, my dear friends, motivation for suicide is anger towards others directed on self, a mean to escape from suffering. I had COVID and my lungs are still bad. I don't know why I should live. I have heart disease for a long time. I have stroke. I am a burden for everybody. I'm to leave myself. I wish to be reunited with loved ones. I still remember this boy who told me that my girlfriend passed away, and one day I will go and meet him or her. And he was admitted. He was treated by many psychiatrists, but he still harmed himself by hanging with the dupatta. So very important to look at children who have lost their parents and who have extended grief. A lot of children say, I would like to go back to my mother. I miss her. I would want to go to the place where she is. Hopelessness. One of the most important reasons. I see darkness in front of me. My brain is dark. It's not lit. The bulb inside is dark. It's not lit. And what is very important for us all teachers? To spread hope. Blind sharing of hope. अच्छा होने ही वाला है. And when you share a lot of hope, the brain gets tickled. What is very important for us to see is whatever happens to the child, failure, passing, illness, let us rekindle the hope inside his mind through different mechanisms and different methods, which you all know. Recent loss of money, as somebody shared about financial state, of death, shame or humiliation, and sometimes manipulation. I would like to marry this girl only, and if you don't allow me, I'll kill myself, and they get admitted to the hospital. Now that people get very angry at such people, but what is important to understand is the help-seeking behavior is very abnormal. We need to bring in healthy help-seeking behaviors, which is very important. What are the early signs where you need to be very careful? Little interest or pleasure in doing things, feeling down, depressed, and hopeless, trouble falling or staying asleep or sleeping too much. I have shared this about energy. I told you about appetite or overeating. Feeling bad that you have let yourself and your family down, bad concentration. And H is psychomotor excitation, moving or speaking, or sorry, psychomotor retardation, moving or speaking so slowly that other people could have noticed, or being so restless and moving around, that is psychomotor agitation. And the last is thoughts that Sala mar gaya to acha hai, and that I think is very, very important. My dear friends, this is very important, very, very important. 4 out of 10 women dying from suicide in the world are Indians. This is one questionnaire which you can use for people above the age of 18. And there's a key to this questionnaire. This questionnaire is validated in our country and standardized over many languages. It's free, available on the net, and you can use it in your classroom also to screen children for depression, largely above 18, but you can use it between 16 to 18 also.